Hi, this is Pete Kears for Cantissimo Senior Living. Cantissimo Senior Living was created to provide housing, education, community, and services to the senior living market. We understand the anxiety in choosing a senior lifestyle. We're trusted advisors providing free information resources in simple, straightforward language to help individuals discover vibrant, worry-free lifestyles. Check us out at CantissimoSeniorLiving.com. Cantissimo Senior Living, experience beyond measure. This video is the fifth in a series about preparing for Medicare. Some Medicare enrollees want more healthcare benefits than original Medicare can offer, even with Medigap supplemental policies. Medicare Advantage plans, which are also known as Medicare Part C, fill this need by providing more benefits for enrollees who agree to extra costs and less flexibility. Offered by private insurance companies, Medicare Advantage plans provide Part A and Part B coverage as an alternative to original Medicare. Medicare pays a fixed amount to these insurers for each person enrolled in their plans, but requires these companies follow specific rules. However, these rules allow the companies enough flexibility to offer more services. To do this, they may handle out-of-pocket costs differently and impose certain restrictions on enrollees. An enrollee must be eligible for Medicare Parts A and B, live in the planned service area, and be a U.S. citizen or legal resident. Potential enrollees with other coverage from an employer or union may need to give up that coverage if enrolling in a Medicare Advantage plan. Medicare Advantage plans deliver the same Part A and Part B coverage as original Medicare, but may offer coverage for additional services. Examples are fitness programs, vision and hearing and dental, transportation to doctor's visits, over-the-counter drugs, services that promote health and wellness, and special benefits for chronically ill enrollees. One of the major benefits of Medicare Advantage plans is a cap on out-of-pocket expenses. Under original Medicare, there is no limit to such costs in terms of co-payments and co-insurance. In contrast, most Medicare Advantage plans will pay all Part A and Part B expenses after the enrollee reaches out-of-pocket limit. However, to provide these benefits, Medicare Advantage plans require their enrollees to abide by certain restrictions. Some plans allow access only to providers in their network. Original Medicare allows enrollees to see any doctor accepting assignment. These plans often involve higher out-of-pocket costs in the form of higher deductibles, co-pays, and co-insurance. Some plans may allow access to out-of-network providers for even higher out-of-pocket costs. Plan rules change every year. This may force some enrollees to seek different plans that better meet their needs. As I just mentioned, a key disadvantage of some Medicare Advantage plans is restricting enrollees to a plan's provider network. Enrollees can possibly get back with their original provider by switching to another Medicare Advantage plan or switching to original Medicare during the annual renewal period. Medicare Advantage plans can differ in terms of how they offer benefits. These plan types differ not only on costs, but also in terms of requirements to only use providers in its network, offering prescription drug coverage or not, and requiring a referral to see a specialist. So, what are the costs of a Medicare Advantage plan? Insurance companies offering Medicare Advantage plans juggle various financial components to create a basket of benefits that differentiate them from the competition. For examples, for premiums, some plans pay for all or part of the enrollee's Medicare Part B premium. Then there's deductibles. Deductibles will vary among plans. Higher deductibles could mean lower copays and coinsurance. And then on copays and coinsurance, these costs vary among the plans. However, Medicare Advantage plans are not allowed to charge more than original Medicare for some services like skilled nursing care, dialysis, or chemotherapy. Copays and coinsurance for out-of-network services may be higher for plans that have their own provider network. So how do you sign up for one of these plans? Medicare providers at various times allow enrollees to join, switch, drop, or make changes. The first one is the initial enrollment period. It encompasses the 7 months beginning 3 months before age 65, the 65th birthday month, and 3 months after that. There's an option in the first 90 days after enrollment to switch to another Medicare Advantage plan or original Medicare. Then there's the regular Medicare Advantage open enrollment, which is January 1st through March 31st. Those enrolled in a Medicare Advantage plan can switch to another plan, drop a plan, or return to original Medicare. There's also the option to join a separate Medicare drug plan if the enrollee needs one. Then there's general enrollment. Again, it's also January 1st through March 31st for Medicare enrollees who have Part A and are receiving Part B coverage for the first time. And then a Medicare Advantage plan can be joined with coverage starting July 1st. And then open enrollment, October 15th through December 7th. Medicare enrollees can join, switch, or drop a Medicare Advantage plan with coverage beginning January 1st. If an enrollee has a change of heart, there's the option to switch to another plan or original Medicare during the Medicare Advantage open enrollment period mentioned above. Then finally, there's a special enrollment period. In most cases, Medicare Advantage plan goes from January to December. However, for people experiencing certain life events like moving or losing other insurance coverage, then they may be able to join, switch, or drop a Medicare Advantage plan during the year. Given all this information, how do you go about buying a Medicare Advantage plan? First, potential enrollees should take time to write down all their healthcare priorities. Items on the list could include what known or potential conditions need to be treated, how much out-of-pocket costs can the household bear, and which prescription drugs are being taken. The process for buying Medicare Advantage coverage is greatly simplified by using the online Find a Medicare Plan tool by going to www.medicare.gov/plan-compare. Go to the page and find the New to Medicare heading, and under that heading, click the icon for Learn More About Options. You'll be prompted to enter your zip code, and then a screen will appear with one side devoted to Original Medicare and the other side to Medicare Advantage. Click Medicare Advantage Plan. Then a screen will appear with the heading Your Medicare Coverage Options. This screen shows the overall attributes and price ranges for Medicare Advantage policies. When you are ready to look at its specific plan type, click Look at Plans at the bottom of the page. On the subsequent pages, follow the prompts and find the plan types and companies that offer plans. Once you've selected some plans to consider, look at these factors to compare them: premium, deductibles, copays, coinsurance, cap level on annual copays and coinsurance, other services offered than Original Medicare, foreign travel, out-of-network options, and helpline availability. Also, if a particular service, drug, or supply item is required, check to see which plans provide that coverage. Once you apply to the plan you like, the process of organizational determination starts, in which the plan must provide an oral or written decision on coverage. If coverage is denied, the plan must provide information on how to appeal. I hope this information on Medicare Advantage plans has been helpful. Check out the rest of the videos in this series that explore the other parts of Medicare at www.cantissimoseniorliving.com/videos. This is Pete Kears for Cantissimo Senior Living. Talk to you next time.